Knowing when your body needs a specific vitamin is crucial for maintaining optimal health and preventing deficiencies. Vitamins play vital roles in various bodily functions, and deficiencies can lead to a range of health issues. Now, by understanding when and why your body might need certain vitamins, you can ensure you're getting enough through diet or supplements, preventing potential problems and supporting overall well-being. Now, the key question is, how can I get the vitamins and minerals I need? It is usually better to get the nutrient you need from food rather than pill. And that's because nutrient-dense food contain other things that are good for you, like fiber. And of course, most older adults, once you are getting age and then, older adults, they need more of this nutrient, to keep going and then to keep you healthy, energetic, and so on and so forth. So most older adults can get all the nutrients they need from food. That is, you have to eat healthy, you have to eat well, you have to eat properly, your food needs to be balanced, you have to cut down on eating unnecessary canned food or processed food. But if you're unsure, always talk with your doctor or a registered dietitian to find out if you are missing any important vitamin or mineral. Your doctor or a dietitian may recommend a vitamin or dietary supplement that suits what you need at the moment. Yes, you can have a need for a particular vitamin and you wouldn't know. So, just sometimes when we want to take something and they just say, oh, it's vitamin C, somebody can just tell you, oh, just take vitamin C for this or take vitamin C for that. Now, the best thing you need to do, especially for older adults, when you feel somehow or something is missing, you have to always go check your doctor, your dietitian for recommendation. Oh, I think I need a supplement. What supplement do I need at a particular moment? Now they'll ask questions to be able to know, okay, what is missing and all that. So it's important to be aware that some supplements can have side effects, yes, such as increasing the risk of bleeding after an injury or changing your response to anesthesia during surgery. Supplements can also interact with some medicines in ways that might cause problems. For instance, vitamin K can reduce the ability of the common blood thinner warfarin to prevent blood from clotting. So if you do not you do need a supplement, your diet, your doctor or pharmacy can tell you what supplement or doses are safe for you, because they vary, they can have side effects. Just because it's a supplement, it doesn't mean just because it's a supplement or because you need vitamin, all the vitamins are good. No. You have to get to understand that the body, you have to give the body exactly what it needs. When you don't give the body what it needs, you start reacting to, different thing at a different time, even when that's the problem. So instead of solving the immediate problem, you're now adding another problem to the problem that is already on ground. Hello and welcome to another episode here on Launch Global. I am Chunk Annamel Joseph, and of course today we're going to be continuing with knowing our vitamins, the importance of taking those vitamins, knowing the right vitamins to take at the right time, and then taking the right vitamin at the wrong time too. So we also need to we'll also be able to understand some of the deficiencies and then some of the sources of those vitamins that you need and all that. So, but before we go into details, of course, we're going to be taking on a quick break, and when we return, we're going to continue. Stay tuned. Welcome back from the short break, and if you are just catching up with us today, I am still Chung Adamel Joseph, and welcome to Lunch Global. So today we're going to be continuing from where we stopped, about vitamins. Now, vitamins are very important to us, minerals, vitamins, good nutrients, our health, our eyesight, and a lot of things. And now, the good thing is there are so many plant-based vitamins out there that we are supposed to be getting used to. But then these days, it's like we're so keen into buying supplements because because we find it easier to take because it's not food, you don't have to cook it, and it's easy to remember and consume. But then the best thing we need to do, the best vitamins we can ever imagine, is that vitamin we get from plants and water, liquid, and all of that. So we're going to be looking at all of those other vitamins that we need, and if there is a deficiency, what does it cause? How do you feel? Now, in one of our episodes, we discussed the vitamins, and we said that these vitamins are into two groups. That's the fat-soluble vitamin, which are vitamin A, vitamin D, vitamin E, and vitamin K, that the body store in fatty and the liver. Now, and reserve of these vitamins can stay in the body for days and sometimes months. Also, the water-soluble vitamins, which are vitamin C and all the B vitamins, these vitamins do not stay in the body for long and cannot be stored. They leave the body via the urine. And in those episodes, we also spoke about vitamin A. And we said that vitamin A is important because they make the immune system work efficiently so it can fight disease and infection. So if you lack vitamin C, your immune system is prone to infection, to diseases. So the lack of vitamin C, now you get a deficiency that your body tends to start reacting. Any little thing that comes in, your body cannot protect you. Now your immune system is your helmet, is your cover, is like the cloth, you're clothing your system. So when the immune system is weak, now you're prone to infection, you're prone to disease, airborne disease, any kind of disease, your body will not be able to fight those infections. And we also said vitamin A keeps your skin very healthy. So if you want to have a healthy skin, then you have to make sure that you're always in doing the right thing, consuming your vitamin C, whether it's food, whether it's fruits, whether it's juice, however you want to go about it is very important. And of course, we said it supports reproduction and growth and also helps with your vision. Your eyes are very important. You need your eyes to function. Now, we also looked at vitamin B as well. The B group vitamins help the body use the energy yielding nutrients such as carbohydrate, fat, and protein for fuel. So some vitamin B groups are needed to help cells to multiply by making new DNA. And we said in the vitamin B group, we have like 8 vitamins in the B group, and then they work differently. You can decide to have all of this together. They work perfectly well. They are good for our body. They are good to keep us healthy. They help you with your protein, your carbohydrate, your fat, and all of that. So, and we also spoke about vitamin C, which is one of the popular vitamins. Anytime when you're down or your immune system, they say something wrong, they say you lack vitamin C, take vitamin C. We are so concerned. We have so much of knowledge when it comes to vitamin C compared to other groups of vitamins. And we said the dietary intake of vitamin C, that's from food and drink, is essential because the human body cannot make this vitamin from other compounds. We also need to have vitamin C as a regular part of our diet because the body cannot store vitamin C for a very long time. So these are the water. Vitamin C is a water soluble vitamin. So it doesn't stay in the body for long. Any small thing, you take it, you consume it, it flushes out via your urine. So you have to be taking vitamin C frequently. It has to be like a daily thing, and that's why some people prefer to just take oranges instead of using the dissolvable vitamin C like tablet. There are lots of vitamin C's out there. So, and today we're going to be continuing from the vitamin D, that's the D group vitamin. Now we'll get to understand what do they do for the body, why do you need this vitamin D, and of course what are some of the deficiency. Now vitamin D is You know, most of the time, I think while I was growing up, we were always told that, oh, you know, the sunrise, that sun in the morning is very good. And I was like, oh, I was thinking they're just saying it. It's just like, oh, you know how parents can be. But then growing up, I got to find out that's the perfect vitamin D that you can give yourself. So, you know, when you're there, you're waking up in the morning and the sun, just spend just a few minutes in that, you know, the ultraviolet radiation from the sun is very, very important. Like, it works perfectly magic. You know, it fills you, it keeps you going. Your daily recommended intake of vitamin D is like it's sorted out. Now, vitamin D is important because it works very well for strong bone, muscles, and overall health. Now, you know, when your bones are weak and you don't have that muscle, it's like you're dropping, you're weak, you don't have strength. You easily have back pain, your joint hurts, you can easily have fracture when you sleep. Maybe you're having like fractures on your leg or your hands and all of that. Now, this is very important for people who are getting aged. You know, you have to make sure you do not lack vitamin D, because you need to be strong, you need to be very active, you need your muscles. You must not lose muscle, because once you're aging, you're losing muscle. Before you know, your skin will start flaking. It will not flaking. It will start dropping. Your skin will not be firm the way it's supposed to be, and that's because you are losing muscle. Now, the ultraviolet UV radiation from the sun is necessary to produce vitamin D in the skin, and is best natural source of vitamin D. Regular physical activity also assists with the body's production of vitamin D. The body can only absorb small amounts of vitamin D, so spending too much time in the sun may increase your risk of skin cancer. So you need it just in, not too much. You have to avoid, you know, too much of everything is bad. So when you're doing it just for a small period of time, and then you're good. And you also have to remember to use your daily sun protection, especially at the times when the UV index level are at high, they are high as 3 or above. And I think this particular season that we're in here in Nigeria, you know, even in the mornings, you see that the sun is kind of harsh, and we're like, it's just 9 a.m., it's just 8 a.m., why is the sun so harsh and all that? So when you're going out, you know, this period, you should try and use your sun protection, you call it sunscreen, so that it doesn't affect your skin. So, but for food sources of vitamin D, they are only a small amount. Around 5 to 10% of vitamin D is sourced from our own diet. So sources include fatty fish such as salmon, eggs, margarine, and some milks have added vitamin D. Now, for the deficiency, it is important to achieve a good big bone mass early in life. Vitamin D deficiency can result in a decline in bone density in adults' life, increasing the risk of osteoporosis, fall, and bone fractures, especially for older people, rickets in young children, a preventable bone disease. Now, treatment options include improved sunlight exposure, diet, exercise, vitamin and mineral supplements. If you are concerned about vitamin D level, see your hospital or your doctor. They may give you a recommendation of the supplement you will need, which will be taken strictly by director. So if you're confused, you're not sure how to go about it, what supplement do you need to take, then you can see your doctor or your dietitian, and then they will help you sort out that. But then don't just take the whole thing into your hands and then be the pharmacy, be the doctor, be the dietitian, and all of that. You know, you have to give professionals the chance to be able to give you direction, and that's why they are there. Now, we're also going to be looking at vitamin E, which is also one of the vitamins. Trust me, all the vitamins are very important. One is not better than the other. We all need those vitamins to survive. Now, vitamin E is an antioxidant that helps protect your body against damage from free radicals. Who doesn't need that? We all need to protect our bodies from free radicals, such as exposure to cigarette smoke or radiation. It's also important for our vision, very important. You know, as you age, if you're not taking care of your eyes, you like vitamin E, before you know it, you're beginning to have issues with your sight. Now, your immune system as well, your skin, and of course it is important for you to take care of those things. Are major. You need them. When your eye is not good, it's a problem. When your immune system is not good, don't forget, you are being exposed to danger. There's no protection. You cannot fight them because you are weak. And of course, your skin is the outside part of you. You know, the first thing people see is what is outside before they see what is inside. So you have to make sure, and that skin, if you don't take care of it, you are likely to get skin cancer and a lot of other infection. Now, for the dietary sources of vitamin E, it is best obtained from a healthy diet that contains plenty of fresh, minimal processed food. Vitamin E is also vulnerable to heat, especially cooking methods such as deep frying. For the dietary source, you have meats, that's for instance liver, egg yolks, leafy green vegetables like spinach and broccoli, nuts and seeds such as almond, sunflower seed, peanuts and hazelnut. Then healthy oils such as extra virgin sunflower, soybeans, and unprocessed cereal, and whole grains such as wheat jam. So, and for the deficiency, it is very rare but can happen in people with disease that cause fat malabsorption like citric fibrosis. Now, it is another deficiency, and then you have to try your best to protect it. Now, vitamin E is also transferred to them from their, it can be transferred to like infants. I mean, you can, there are other diseases that can be gotten when you know the deficiency from vitamin E, and this can be transferred from mother to child, mother to their infant, and of course during breastfeeding. Now, if you have such issues, now you can see that it causes all of those problems because of the lack of vitamin C. And when you check it, sometimes you give birth to your child and then the next thing is having malnutrition, or you know there's something just missing. He's not looking super healthy, and most of the time this is the issue. And that's why it is always advised that pregnant women need to have this vitamin. Like, it's very important that you don't skip that. So this disease is being transferred to them from their mother prior to birth. So please, for mothers, for pregnant women, you have to try your possible best to take the right vitamins. And if need be, if there's every chance and then you feel that something is missing, you have to see a doctor, you know, to just make sure he gives you the right recommendation. If you just, even if you feel okay and then you want to take the right vitamins, you want to stay healthy, you want to protect your child, you know, you have to try your best. Go see a doctor. Don't take the decision into your hands just because you've gone to maybe a pharmacy and then you've seen, like, you know, the right thing on it, or, you know, checking the labels and everything. They just tell you, oh, it's good for pregnant women, and then you want to go ahead and take it. Trust me, most of the time it is not the way we see it. So it's best you go to a doctor and get the right recommendation. And then the next, we're going to be looking at vitamin K. Now, vitamin K is important for healthy bones, blood clotting and wound healing, newborn babies to prevent a serious bleeding condition called hemorrhagic, then disease of the newborn, that's HDN. Dietary sources of vitamin K, we get vitamin K from food and the bacteria in our gastrointestinal tract. Then for the newborn babies, they are given a booster to increase their vitamin K level because they are born without bacteria in their gastrointestinal tract. We get much of our vitamin K from our diet. So for food sources, you can go in with your leafy green vegetables, spinach and kale, very healthy. Fruits like avocado, kiwi, you know, they are green fruits, very important. Some vegetable oils such as soybean oil. Now, for the deficiency, it's unlikely except when fat is not absorbed properly or when certain medications are used. For instance, antibiotics can kill the gastrointestinal bacteria that produce vitamin K. Additionally, anticoagulant drug or blood thinners may cause problem with vitamin K in the body. So you have to check your doctor if you have any of the concerns. Now, I want to talk about the antibiotics we take most of the time. You know, sometimes it baffles me when I see people take so much antibiotic, and I'm like, really? It's not everything you take that I know people who, they will feel a kind of way and the next thing they will just go buy a certain kind of antibiotic. Now, this kills. It's very dangerous for you. You might not see the effect. You will think, oh, I'm taking it, I'm staying healthy. But then, as medication as simple as paracetamol, it's not good. You don't take medication even when it's not recommended. You know, we like self-medication, especially in Nigeria. We like self-medication is like we're all doctors, we're all pharmacists, we're all dietitians and nutritionists, and we're all professionals in every aspect of life, especially when it comes to our health. Sometimes we go to the pharmacy and we're like, I want this. You already have your medication, you know, no doctor's reports, no anything, and then, well, they give you the medication. I know there are certain medication or certain antibiotics, when you go and ask for it, it's just a no-no. It can only be served when there's like a doctor's a prescription and all of that. So, but then the issue of taking antibiotic is beginning to be too much, especially for women. We understand that our system reacts, hormonal imbalance here and there, infection there and here. Any little thing, maybe you use someone's toilet, the next minute you're beginning to have like, you know, an infection and all that. So sometimes it baffles, it troubles people. But the best thing to do is to avoid taking too much of this antibiotic, because at the end of the day, it doesn't even work and it starts affecting something that is not supposed to be even affected because it's too much. So please, we have to cut down on the take of antibiotic, because once we keep taking them, it kills the gastrointestinal bacteria that produce vitamin K. So imagine that gastrointestinal bacteria is being killed, and then you will not be able to produce your vitamin K, and you are so much in lack of it. You know, it is another problem. Now, it doesn't only affect you, it also affects your children, affects any child you are birthing and all of that. So please, we have to be very, very intentional when it comes to self-medication. If it's possible, please cut down on it. I understand that, yeah, you know, sometimes going to the hospital, paying bills, a lot of things to do. For you to avoid that, you need to eat healthy. You need to take the right vitamins. Just stay healthy, drink a lot of water, and trust me, you don't have to keep running and buying medication. And besides, medication is not even cheap right now. They are very expensive. So why do you want to keep buying something that is going to kill you at a very high cost? You know, it is so bad. So please, one advice for you today, you have to cut down on self-medication, cut down on taking unnecessary antibiotic. Is going to help you do better in life. So for the sake of time, I think I'm going to be putting a stop here today. Thank you for your time. Thank you for catching up with me on Lunch Global today. I'm still your host, Chunk Annabelle Joseph. Enjoy the rest of your day. Bye bye.